This is the third segment in our podcast focusing on transgender youth and their families. And as we've heard in the prior segments, parenting a transgender child can be challenging, and the medical community may have little advice or resources to help. In this next segment, we hear from a mom, Angel, who shares how her daughter's experience has been and what we can learn from her family's interactions with the healthcare community and the school system.
My name is Angel, and I am mother to 3 children. My 13-year-old daughter is transgender. She was assigned male at birth and identifies as female. It wasn't too clear to us until I believe it was 11 where, she would go and spend her allowance money on girls' clothes. In retrospect, there were definitely things along the way. There were lots of times where I thought, oh, I'm going to have a gay son, and at 11, she did come out as being gay, being attracted to boys, and then shortly after that, we realized that it was a little bit more than that didn't explain everything. So it wasn't ever completely clear from the beginning. She may have said as a young child, I'm a girl, I'm not a boy, but I certainly didn't think anything of it. I didn't acknowledge it if she ever said it. There were things like she would wrap her towel around her chest when she'd get out of the bathtub like a girl or a woman would do. She never ever liked haircuts, but I was very persistent and had her get short haircuts most of her life until she was about 5th grade or so, and when I left it up to her, she chose to have longer hair. We are out in most situations. There are still a few situations like some of our extended family that we don't ever really see, don't really know, and then she goes to a program once a week with other kids, and she's not out there. But other than that, with family and close friends, we're out. It's actually been surprisingly good. We haven't had any terribly negative experiences. Some people have been a little bit slower to accept it than others, but we haven't come across too many people who have been resistant. Initially, I would say the school was definitely resistant. They didn't come out and say anything terribly negative, but definitely had the feeling that they thought we were a little bit crazy. They didn't understand it. And what happened is my daughter actually was bullied quite badly before transitioning. So even just presenting as what some people call an effeminate boy, she was bullied very badly at the schools. She was very secretive about it. We didn't know about it. My husband actually went into the school to pick her up for a doctor's appointment at one point and witnessed it for himself. And then we started asking more questions and realized how bad it was. And so we, tried to work with the school counselor, the principal, and the school counselor told us that their children weren't prepared for this. So we realized at that point that they weren't going to be supportive, and we couldn't continue to send her to that school in such a hostile environment, and we pulled her out and started homeschooling almost immediately. After we started homeschooling, she started telling us more about what she had gone through in school and realized that even some of the staff had been really negative and almost harassing. It was devastating. I felt a lot of guilt for not having recognized it and for not having been there to protect my child, for her having to go through that without us even knowing what was going on, and to put her in such an unsafe environment where you think that, these are adults who should be taking care of my child, and they're not living up to that. I think that there is a very negative idea in our society when it comes to boys displaying anything that would be considered feminine. It's okay in a lot of circumstances for a girl to be a tomboy, to be into sports, or to do things that are typically seen as masculine to some extent. But for boys to play with girls' things or wear something pink or feminine, it's seen as a huge negative by a lot of people in our society. You know, the area that we were living in, I think it was possibly more difficult than some other places, but I think there's probably kids out there who are much worse off, who, you know, would have no support, or their situation could be much worse. They could have experienced much more physical bullying and harassment. And I feel like in some ways we're lucky, but I think that Missouri has a long, long way to go. I didn't seek out advice from my pediatrician. I never brought it up to her. I think maybe I was afraid of what she was going to say. So she wasn't the first person that I went to. And very early on, I really was just very alone. I didn't know who to go to. It didn't even occur to me to ask my pediatrician, or I just didn't know where to go. I didn't know where to begin. And, you know, so I went to Transparent, and they gave me a ton of resources. They gave me the name of therapists, of endocrinologists, pediatricians, things like that. And we just got the ball rolling right away. We chose a therapist, and she did a full evaluation and gave my daughter the diagnosis of, at the time it was gender identity disorder. She has a fabulous therapist. I'm really, really happy with her. We've also found a great endocrinologist who has treated some transgender patients, but is definitely still learning. A lot of times when we go in and ask questions, he doesn't have the answers, but he is willing to find the answers, which is great. One thing that I see in healthcare is there are people who are willing to treat our kids, and there are people who really want to help our kids and learn and try to understand and make a difference in their lives. And I've come across people who, yeah, they're willing to treat her or accept this, but they don't really understand. They don't understand what her needs are. If you don't really understand what a child needs, how can you meet those needs completely? It's been less than a year since she's transitioned, and I still have a lot of fears. I worry about her physical safety when I send her to new places, or, you know, I worry about her future. Will she be able to go off to college and live away from us? Is she going to be safe? Will she find somebody who loves her for who she is? I still have a lot of fear. She has struggled a lot with anxiety, depression. She started on hormones about 6 months ago, and she's kind of blossoming. She's starting to feel like, you know, I'm going to be okay. People are seeing her as she sees herself for the first time, and I think that's really affirming to her. She just wants to be a girl. She just wants to be seen as a girl and accepted as a girl, and that's it. We have been really lucky. Every time we've gone in to try to get hormone blockers, hormones, any type of treatment, I've just gone in with my fingers crossed, and we've been really lucky that health insurance has covered things. I've done things like when I go into the doctor's office, I won't necessarily correct the name or the pronouns in fear that might somehow mess things up with the health insurance or raise a red flag. And that kind of puts my daughter in an uncomfortable situation where she's being called by the incorrect name and incorrect pronouns. My pediatrician has been really good about that. They put in the system her preferred name, and you know, she's explained to her staff the situation, and they usually get it right. But, you know, if we're going into the hospital for a procedure or something and you're seeing new people, I've been really hesitant to bring it to their attention at all for fear of that health insurance rejection. I have heard of lots of parents being rejected for these things. And, you know, hormone blockers can be extremely expensive, tens of thousands of dollars. And, you know, most parents could not afford to just hand that over and pay for that. So we've been really lucky that that's been covered, but not everyone is that lucky. And so we've definitely approached it in a very cautious way. You know, one of the biggest struggles for a lot of these kids is things like depression, and they have an extremely high rate of suicide. I mean, more than almost any other group of kids. So, we need to provide them with these things to keep them alive. These kids are kids, and they need to be loved, they need to be accepted, and they need to be affirmed.